life to save life is one of the hardest ethical dilemmas that we've had to face. This is a quote by George W. Bush. It basically relates to our presentation because we don't have unlimited hearts in the world. Not everybody that needs a heart transplant can get a heart transplant. For this reason, professionals do have to use criteria to choose between candidates.
Good morning, my name is Grace.
My name is Shanice.
Martin.
My name is Sydney.
And I'm Esteban. So our research question is basically which candidate is the best recipient for a heart transplant. Ultimately, we went with candidate D because he's a healthy 45-year-old male who's also part of the upper middle class, has insurance to cover the costs, and he has a family consisting of 3 girls.
First of all, we need to discuss the other candidates, starting with person A. Person A is a 41-year-old widow with a daughter who lives with her grandmother. She is also a former alcoholic who's partaking in rehabilitation. Some of her pros include job option and daughter, while her cons include that she's in rehabilitation, she's a former alcoholic, and these factors signify that there could be some potential mental health issues. As you can see from the quote from David Peters from Australian and New Zealand Mental Health Association, the recovery journey to sobriety brought consequences in certain mental health concerns, such as anxiety. And if you can tell from this graph from the National Institute of Health, anxiety decreases the survival rate for any transplantation. Overall, she was disqualified because even though she has a daughter, she doesn't directly take care of her daughter, whereas person B directly takes care of his 4-person family. And he has no alcoholic history.
Then we have person B. Person B is a 59-year-old male with financial troubles. He suffers from high blood pressure and he had kids that moved away, but he has a wife age 38. His pros is he has a family and he's a very hardworking man. His cons are he's already 59, struggles financially, and suffers from high blood pressure, and he was a smoker for a while. Reason for disqualification, we disqualified this candidate because even though he has family and he wants to see his grandkids, he's already old, struggling financially, and has high blood pressure. The cost for medication after heart transplant is around $1,800 a month. Due to the fact that he's financially struggling, I think it would be hard for him to afford that after. According to NIH, older donors or recipient age is associated with inferior long-term outcomes, and here are the amount of heart transplants done from 1988 to 2013 with the age range.
Okay, so this is person C. She's a woman, age 30. She has an 80-hour work week. She doesn't have time for her family, and she drinks and smokes. Okay, so her pros is that her pros that she's young, she works out, and then her cons is that she drinks and smokes daily. So the reason we disqualified her is because, even though she works out, she tries to take care of her body and stuff, she's still basically destroying her body because she's smoking and drinking every day. So we disqualified her. And even with that, she could, if we give her the heart transplant, with all the drinking and smoking, she would still die from liver or lung problems. And then here on the graph, it shows, according to Phil Bolda from American Journal of Heart Transplantation, smoking after a heart transplant shortens the median survival from 16.28 years to 11.89 years. So there it is right there.
And this person E, she's a 35-year-old woman. She has severe heart problems and she's ready for surgery. Her pros, she's young and she's ready to take in surgery. Everything is fine, but she's unhoused. She doesn't have insurance and she has no family to speak of. And we disqualified her because the fact that she doesn't have insurance and is unhoused makes her make more struggles after the surgery to pay for treatment, to pay for the surgery itself, and it will just make her have a harder life. Because here, the amount of people without insurance has decreased over the years. So every time it's less common to see people without insurance, which makes it less common case to take over.
is candidate D.
We're gonna agree with candidate D with three weighting criteria: health, ethics, and economic.
Here are some of the health variables for heart transplants. As you can see, heart transplants are very complicated procedures with many contraindications. If the patient has any of the listed contraindications, it can result in serious problems post-operative procedures. These include alcoholism, smoking, poor mental health, and high blood pressure. As you can see from candidate D's health description, he has no alcoholism and no smoking history, which leads to better post-operative results and is in relatively good health. Some of his cons imply that there is no heart issue specified, but since he is ready for the heart transplant and he needs that heart transplant to take care of his family, he is ultimately the best choice in terms of health variables.
Then there's the ethical implications. To explain, Dr. Childress and Bertram stated 4 principles of ethics: autonomy, that is respecting the patient's choices; beneficence, that is the doctor's obligation to give the best for the patient; non-maleficence, the doctor's obligation to tell the patient when something is not good for them; and justice, to treat all people equally and equitably. But this one is where the choosing for a heart transplant comes into place, because we can't treat everyone equally, sadly, and that's just the reality we live in today. So we have to base it on our socioeconomic status, and we have to do the best choice, like in the best possible light. And candidate D has a family he has to provide for, and he fills out other types of requirements.
Okay, so I'm going to talk about the economics here with the heart transplants. So the economics are important because it's important to know the financial burden that they impose on people. They often exceed $1 million with post-operative care and long-term care. And this comes with stuff like your medications, your blood tests, and your follow-up appointments. So person D, they were in the right financial position, so that they would be able to pay for their stuff easily, and their health was in pretty good condition aside from their heart issues. So by giving the transplants, it ensures that he can have a happy life and be there for his family.
Thank you.
Thank you.